Today's pain topic of the day is lumbar facet arthropathy and lumbar radiofrequency ablation. This is the facet joint. You may have heard from your pain specialist or seen on your MRI or x-ray that you have facet arthropathy. That means you have arthritis in this joint. These are the joints on the back side of the spine that connect one vertebra or bone in the low back to another. Over time, these joints can get arthritis, just like your hips or your knees. Usually when patients come to see me, they're complaining of achy pain in the morning when they first wake up in their low back. And if they're doing a lot of twisting or bending, like if they're vacuuming in the house or sweeping, or if they're out doing yard work, they'll get a lot of pain. Now, it's important to know that pain from facet joints is usually just in the low back. It usually does not radiate to your legs. When I see this in my clinic and I get imaging and see it on MRI or x-ray, typically I'll recommend conservative things like physical therapy and anti-inflammatories first. Sometimes I'll recommend heat or ice. Ice is better if you've been outside or inside working and the pain has gotten more intense. Heat is usually better first thing in the morning when you wake up and it's really achy. If these things don't help, then sometimes a lumbar radiofrequency ablation can be helpful. So each of these little joints has a nerve supply that goes to it that sends signals to your brain to tell you that there's arthritis in the low back. First, what we do is under x-ray, I put numbing medicine around the nerves that go to the joints. Typically, that numbing medicine lasts somewhere between 2 to 8 hours. So during that time window, I would expect the patient's pain to get a lot better if this is the problem because the nerve to that joint is no longer sending signals. Now, what sort of pain relief am I talking about? So during that time frame, I want to see 70, 80, 90, or even 100% improvement in their pain. If they get that, then you can do an ablation procedure where this time under x-ray, I put a special needle by that nerve, and after it's numbed up, I put heat through the needle that creates a burn in the nerve. Now the nerve goes through a process called Wallerian degeneration, which is a really fancy term to say that the nerve can no longer send signals. That usually lasts for about 6 to 12 months, and over time, the body's pretty miraculous. That little nerve will grow back together again. So how successful is that? So this is a recent study from January of 2025 by Provenzano et al. That looked at real world outcomes for lumbar ablations. That means they looked at patients that were coming into the pain clinic that were doing regular day-to-day activities. They had 193 patients total. The average pain score for the patients when they first started this study was 6.6 on a scale of 0 to 10. At the end of treatment, the average pain score was 3.4 on a score of 0 to 10. Now, they followed these patients for up to 24 months, and they checked in with them periodically. So at the 3-month mark, 72% of patients that had the lumbar ablation for low back pain got greater than or equal to 50% relief, and 69% of the patients at 12 months had greater than or equal to 50% relief. They also asked the patients themselves, how much do you feel like this improved your quality of life? So at 3 months, 62% of the patients who had the procedure said they were much or very much improved. And at 12 months, 70% said that they were much or very much improved. So what's the takeaway from this? A few really important things. One, this procedure can be helpful for you if your pain is just in the low back and it doesn't radiate into your legs. Two, it's really important that you pay attention to how much relief you get from the test shots. If you don't get really significant relief from the test shots, then the procedure is probably not going to be helpful for you. And my last caveat, we always have to have good patient selection. So make sure you trust your pain specialist. And I hope that this information helps you ask them good questions and to know if this is the right treatment for you.